Floss, don't floss. Mouthwash, use it, don't use it. Electric toothbrush, manual toothbrush. It's super confusing to know what to do. I'm not gonna lie. The choices are vast. The information is limitless. So I'm here to tell you as a dentist about a few of my recommendations, what to do, what not to do, and hopefully that can give you all the information you need to make some decisions that you want for your teeth. But before I begin, as always, don't forget to subscribe and like to my channel, because I will continue to give you all the knowledge that you need to equip you so that you can make the decisions that best help you. So let's start. Okay, electric toothbrush versus manual toothbrush. Now, I prefer an electric toothbrush. Why? Well, there are a few reasons. Reason number one is that an electric toothbrush ensures that you don't put too much pressure when brushing your teeth. Now, with a manual toothbrush, we've got the aggressive scrubbers, the over-enthusiastic toothbrush people. Think of the ones that go up and down. That can actually cause your gums to recede upwards. And once the gum is gone, you can't make it grow back. Whereas with the electric toothbrush, it has some functions that make sure you're not over brushing and you're not being too vigorous. So for example, they have a bounce back feature, which can alert you when you're brushing too hard. Some of them even stop. So I do really like it for that reason. Another reason is that you have to spend a whole 2 minutes brushing your teeth. Yes guys, 2 minutes. It's really, really long. Have you ever tried brushing your teeth for a whole 120 seconds? Why won't you try that experiment? Try brushing with your manual toothbrush and timing yourself. I guarantee you're not fulfilling those entire 2 minutes. So again, we've got a timer that ensures that your teeth are being brushed for as long as it should be. Now, a manual toothbrush can be good, but the only thing is that you have to do what we call the modified Bass technique. That basically means that you have to angle the toothbrush at a 45-degree angle. It has to brush your gums and your teeth to be able to clean underneath the gums as well. Now, if you've got this technique down to a T, of course you can use a manual toothbrush, but it's super rare that people actually know how to do it and do it well and properly. Now, for electric toothbrushes, I love the Philips Sonicare. Oral-B are very good as well. Oral-B is based on an oscillating system. The Philips Sonicare is based on a sonic-based system, which I really like. Now, it also depends on your preference, so whether you prefer one or the other. And again, your dentist can show you, they may have a demo, they may be able to advise you further depending on your needs. With the Philips Sonicare, I use the Diamond Clean and I love it. You also want to try and go for something mid of the range. You don't want to go for the battery-powered electric toothbrushes, because as the battery dies, the electric toothbrush gets less powerful, it's not doing its job as well, you haven't really noticed, and your teeth aren't as clean as they should be. So with the charger one that's charging all day, it's got the optimum power to keep your teeth clean, and I do recommend it. So you want to go for a charged one. You can choose between sonic or oscillating, depending on your preference. So we understand a little bit about the difference between electric versus manual. Now, if we're going to go for manual, I always recommend a bamboo-based toothbrush. We actually have one as part of the Parlor family. And of course, you want to reduce the plastic impact that you're having in the environment. Obviously, the electric toothbrushes, they do have plastic, but they last a very, very long time. So it's better than the manual in that sense, the manual plastic ones. So I hope that gives you a better idea. But we're ready to move on to the next thing. What about floss? Now, floss is super confusing. So what I've done is I've actually taken a piece of floss. You basically want about 18 inches. You then grab the floss and wrap it around your middle fingers until you have a centimetre or two. So a bit like this. And what you do is that you glide the floss between your teeth and you want to form a C-shaped curve around the gums and the teeth. So like so. And put it out. You don't want to go up and down, you literally can just put it out. You get the dirty bit, then you wrap it around one finger and you feed a little bit of the clean one from the other finger, and you do the same on each tooth. People find flossing really difficult, but you can try and have a go and practice. And another thing is that you put your index and thumb like this, and you can work on the back teeth as well, like so, and take it out. There are a few videos on that as well, which I can link in the section below, which you can have a look at. One other thing is using TP brushes. TP brushes are amazing. There are these little brushes that come in various sizes, and each size goes between the teeth and is relevant to the tooth that you need to clean. So what I mean by that is that your back teeth might need bigger bristles, your front teeth might need smaller. So you might need an array of TP brushes to use, and whatever you need, your dentist will advise, but it's not one size fits all. It's a bit of a knack, but what I do is I get the brush, I basically bend it to a 90-degree angle and put it between the teeth, and it's really, really excellent to clean between the teeth, because brushing's great, but let's be honest, it's not gonna get between the teeth, and getting between the teeth is so important because it's one of the most obvious places to get tooth decay and for bacteria to harbor and create holes in your teeth. I love Super Floss as well. So Super Floss is the one that's got the hard ends and a bit of a fluffy bit in the middle. If you need to get into really hard to reach areas like bridges or fixed retainers, the hard bit can go between those areas. You pull it, the soft bit cleans between teeth, and you can pull it out the other end. So it's got that kind of rigidity on either end to make sure that you can grasp onto it and can go between the teeth really well. One of my new favorite things is a water flosser. I love Waterpik's water flosser, and I use it almost every day. You basically have a vessel, you fill the vessel up with some warm water, maybe even a little bit of mouthwash. You start from the back, the little tip that you choose goes between the teeth, and you go from the back and you work your way to the front. What I love about it as well is it has lots of different tips. It's got an orthodontic tip, it's got a tip that's a plaque seeker, you know, for just everyday use. It's got a tongue scraping one, so lots of tips for different parts of your mouth, which means you can get a really good clean between the teeth. Loads of my patients are like, I love it, it gets out loads of stuff, and it's very, very easy to use, and I would use it at least once a day, preferably at night before you go to bed, and that really does help keep your teeth clean. Most importantly about what I've said about all this stuff is it helps remove staining without being too abrasive on your teeth. So often when you go for whitening toothpaste, they have sandy or abrasive particles which can strip away the enamel permanently. You really don't want to go for that. You want to go for something that's gentle, and all these things help remove staining in a very gentle way. Then it brings me on to my next bit, which is mouthwash. Guys, I always say mouthwash is a little bit like using deodorant without taking a shower. If you haven't done the correct cleaning to begin with, it will only mask things, it won't cure things, and you really need to make sure that you are using mouthwash as a supplement, but not as something to just keep your mouth clean. You need that mechanical movement of the toothbrush and the floss to get between the teeth and on top of the teeth. So with mouthwashes, I recommend something that has some fluoride in it and is non-alcoholic. Alcoholic mouthwashes can be a bit irritant to the tissues. So I personally love Curacept. I also love Ultradent, and I think it's really important that you have a conversation with your dentist. Long-term use of Corsadil is not ideal because it can cause your teeth to become brown, and it's a nightmare for us to get the staining off, and it's not designed for long-term use. So you really, really need to make sure that the dentist is prescribing you that or advising that before you go to the shops and just buy it, and you need to understand what it is for. So let's have a quick summary so we understand. I recommend electric versus manual unless your manual technique is perfect, also known as the modified Bass technique. I also recommend brushing for 2 minutes twice a day. I recommend using floss and TP brushes. If you can't get the floss, try the TP brushes, different sizes for different parts of the mouth. Super floss for those very hard to get areas that need special attention, such as bridges and fixed retainers. Water flossers are amazing as well to get between the teeth, irrigate, very easy to use. And mouthwash is not a substitute. You can get away with not using mouthwash. If you want to supplement it with your cleaning, yes. You should also use it at a different time of day to flossing and brushing so that you get the benefits, and it gives you that fluoride brush to help prevent cavities and protect your enamel. So I hope that's helped, that whistle-stop tour, which I love so much. But of course, if you've got any other questions or want to know more, feel free to drop it into the comments box. And I can't wait to see you guys all again very soon.